You know that feeling? A headache. It seems pretty simple, right? But what if I told you there's basically an entire encyclopedia, a real rule book that meticulously defines hundreds of different types? Today, we're going to use that very guide to crack the code on the one you've almost definitely experienced, the tension type headache.
So here's our game plan. First, we're going to look at the big picture, the whole world of headaches. Then we'll zero in on the tension type headache, or TTH, and see how it's not just one thing. We'll even tackle that classic confusion with migraines before we get to why all this detail really matters. Let's dive in.
Okay, so first up, we're mapping the entire world of headaches. And to do that, well, you need a map, right? In the medical world, that map has a name, the International Classification of Headache Disorders, or the ICHD-3. You can think of it as the official field guide for every kind of head pain imaginable. So that brings up a pretty good question. How many different types of headaches do you think there actually are, like officially recognized by science? 10? 20? Maybe 50? The answer is hundreds, literally hundreds of them. This is a massive, super complex field, and that's exactly why we need a guide like the ICHD-3. It's what brings some much-needed order to all that chaos.
The ICHD-3 basically splits all headaches into three big buckets. You've got Part 2, the secondary headaches. Now these are the ones that are a symptom of something else, like a head injury or a nasty sinus infection. Then there's Part 3, which covers pain from nerve problems in your head and face. But for us today, the main event is Part 1, the primary headaches.
And this is a really important distinction. With a primary headache, the headache itself is the problem. It's not a symptom of something else going wrong. The headache is the thing that's going wrong. The pain is the disorder. And this is the category where you find the big names, like migraine, and of course, the tension-type headache.
All right, now we can zoom in on our main topic. Section 2, defining the tension-type headache. We're talking about the single most common headache on the entire planet.
And here it is. The tension-type headache, or TTH for short, is without a doubt the most common primary headache out there, period. This is the one most of us are familiar with. It's such a big deal, in fact, that it gets its very own chapter, Section 2, in that official guide we've been talking about. Okay, on to Section 3, a spectrum of frequency. Because, and this is so important, not all tension-type headaches are the same. Yeah, they are definitely not all created equal. What separates a meh, this is annoying kind of headache, from something truly life-disrupting? Well, it all boils down to one simple factor, how often you get them. So the ICHD-3 splits TTH into three main flavors. First, you have infrequent episodic. That's your once-in-a-while headache. Then there's frequent episodic, which, as the name suggests, happens a lot more often. And finally, you have chronic TTH for people who are dealing with this on a near-constant basis. And this isn't just about being picky with words. This classification is absolutely crucial because it changes the entire game plan for treatment and management.
All right, Section 4, and this is a really interesting one. TTH versus migraine. We're looking at the diagnostic rule, because here's where things can get a little tricky. What happens when a headache seems to be having an identity crisis? It kind of looks and feels like a tension headache, but it also has some migraine-y features, so how do doctors make the final call? So picture this scenario. A patient's headache checks every single box for a tension-type headache. It's a perfect match, but it also checks almost all the boxes for a migraine. It fits the technical definition of what's called a probable migraine, meaning it's just missing one little piece of the migraine puzzle. So, which diagnosis wins?
And this is where that official rulebook is just so brilliantly clear. The ICHD-3 has a specific tiebreaker rule. It's right there in the text. The general rule that definite diagnoses always trump probable diagnoses. So if a headache is a definite tension-type headache and only a probable migraine, then TTH gets the win. A sure thing always beats a maybe. Simple as that.
So that brings us to our final section. Why does any of this classification matter? I mean, that whole Trump rule is a perfect example. Why do we need to be this precise? Well, it turns out that getting the diagnosis exactly right has huge implications, not just for patients, but for medical research as a whole. And you know what? The guide itself explains its own importance perfectly. For a straightforward open and shut case, a doctor probably doesn't need to crack open the book. But for those tricky cases where the diagnosis is uncertain, that's when this guide is an absolute lifesaver. And for research, it's non-negotiable. It ensures that scientists all over the world, from Tokyo to Toronto, are studying the exact same condition. That's how we make real progress. So, let's do a quick recap of the key takeaways. First, the ICHD-3 is the global gold standard for all things headache. Second, the tension-type headache is the most common primary one out there. Third, we know TTH isn't one-size-fits-all. It's broken down by frequency. Fourth, there's that brilliant Trump rule to sort out any confusion with probable migraines. And finally, and most importantly, this precise system of classification is the bedrock for both getting patients the right treatment and for pushing research forward.
So I want to leave you with one final thought. We've just spent all this time digging deep into the what a headache is according to this incredibly detailed system. But does defining the what with such precision actually get us any closer to the ultimate prize, understanding why it happens in the first place? That, right there, is the next great frontier. It's the big question that all this classification helps us start to answer. Thanks so much for diving into this with me.